On PM Express tonight, a conversation that has engulfed the entire country, a conversation about coronavirus, that we know 6 confirmed cases so far in this country of ours. Has killed more than 5,000 people across the world. There is a scramble right now to try and make sure that the cases do not spread any further. And we're going to look at averting the worst case scenario today on the show, really, because that is where we are right now. Now, we know fear-gripped Ghanaians, as we saw the cases confirmed over the last weekend, but also into last week when 2 cases first emerged. We are now talking about 6. The president on Sunday then addressed the nation, announcing a raft of new measures to contain the virus, including closure of schools. That was a major part of the things that he announced over the weekend. We'll return from the break. We'll speak to our guests who are already seated. My guest in the studio tonight is Reverend Professor Kwame Nasego. He is a virologist, but with the Department of Medical Microbiology, University of Ghana Medical School. I'm grateful, Prof, for joining me on the show. Dr. Justice Yangsing is the General Secretary of the Ghana Medical Association. They have a statement out tonight that I'll be sharing with you shortly. We're going to go into the details of the statement. It's very comprehensive. But in any conversation that we have on the coronavirus matter, I want to begin by first doing the needful, the public education bit of it, because the government is already spending money to do this, but this is airtime and being responsible. We need to start with that. Prof, that's what I want to start with you. We are at the time when 6 cases have been confirmed. We don't know how many more contacts there have been. Tracing is happening. It's almost certain that the numbers will go up, almost certain. In terms of what people they come in contact with. There are people who hold that view and expecting the worst case scenario. You are the expert in the field. You've had 6 confirmed cases. What's your reading of what is down the line a week or 2 from here whilst testing is going on?
So that is why basically we are trying to, all these harsh measures have been put in place. The whole idea is to try to trace contacts, to monitor them. So I don't think we should say that we will definitely have some community transmission. I think that...
Explain that. What is community transmission?
Well, I mean, the cases were imported.
Yeah.
So if within the community you come and you pass it to one another, that then is not imported. So then it becomes an issue that you know that within the country is being transmitted from person to person.
Okay, as in the people who came in also transmitted.
Those are imported. So if we can still keep... I mean, now they've also tightened up in terms of entry, those coming from different countries. You have to, I think you're supposed to self-isolate yourself for 14 days.
Yeah.
So all these are to help to make sure that we don't get it spreading within us. The danger becomes when it starts spreading amongst us. Yeah. And then the cases are no more imported. That's why you know that in their communiques, they tend to stress that these cases are imported.
Yeah, however, I think part of this, and I think we're all learning lessons from the countries that have gone before us, China, Italy, etc. I mean, being candid with the people is the best way to start. Yeah. If you tell us that we can expect more, the people get more protected, and you also add to it the education and what you need to do. I'm saying that 6 confirmed cases, there have been contacts. We know parties who have been held, etc., etc. In your professional understanding of how this virus works, should we say it's only 6 and therefore we can just close our mind? Because people are being complacent already. It's 6, it's okay, don't do much. What is the likelihood that as people do contact tracing, there could be more cases, knowing the 6 already that we have and the contacts they may have had?
It depends on the nature of contact they've had. Okay, because I can't confirm this, but I hear that the Legon issue, one of the very close friends has been tested. The person is still negative. People can say it's early days yet, but you can't just, you see, having an infection leading to disease has different factors determining it. It's not just because you've come into contact that immediately you go down.
Let's start from there. This is part of the public education. What sort of contact leads to that? Because we are afraid, we are cleaning the surfaces now. We are applying whatever it is. What sort of contact leads to you being possibly infected?
In simple,
What would it take?
in simple terms, any contact that gets enough of the virus to infect you is a contact. So
define that in real terms for us.
Well, I mean,
handshakes. What is it?
It could be handshakes. The fact is, it shouldn't enter your mouth. It shouldn't enter your nose. It shouldn't enter any of the orifices on your face. Okay, so that if I touch it and I touch my nose, or I actually hold my nose, then the fact is, I'm going to inoculate myself with whatever I've touched it with. Obviously, if I have a lot of inoculum, it will be faster and quicker. If it's few particles, you don't expect it to be that faster, but they can all lead to disease. I can't quantify and say this amount of virus particles. In any case, we can't see, but the best thing is to avoid any contact whatsoever.
But then apart from the physical contact, there's also leaving it on surfaces, right?
Yes.
So go through that for me.
Okay, so you see, if I sneeze just now and then I have the virus and I do not cover, or I don't use a tissue to block my nose, what I'm going to leave is I'm going to leave a surface of the virus here. So you have another program and you don't clean this place. Yeah. And another person comes to sit here. The person then sits this way, leans on the table, and then does this and starts holding his nose. Maybe he's thinking about what to say. That's a way of transmitting to the person inoculating himself or herself. And that's a contact. It's a form of a contact. And I always tell people that we open doors, right? And when I open the door, I go away. Yeah. I don't know where the next person is coming from. Maybe it's a hospital, maybe it's my office. But I don't know where the next person is coming from, who he or she has met. The person opens the door. The fact is, so if the person has left anything, I pick it up. And that's why,
on the door handle?
Yes, that's why the education is wash your hands as frequently as possible with soap and water. And in the absence of that, use hand sanitizer, alcoholic sanitizer, or rub alcohol rub to rub your hands carefully. The whole idea is that you will kill the virus. Okay, and so even if perchance by mistake you touch your lips or your eyes, you're not likely to get infected.
Okay. A few things, again, just to clear that we are all going to and learning. So I bought many gloves. I came to wear with gloves and face mask. To what extent does that protect you?
Well, I've seen a lot of people are looking at gloves.
Yes,
I'm sorry to say this, but for me it was fun. You know, I was like, wow. I mean, this is how far people have gone. I came to work. I mean,
the stigma let me eventually remove it because everybody was like, but seriously, talking seriously, yes. Does that protect you?
Let me say something first. You know, when my wife came home, we were chatting. It said somebody was wearing a nose protector, and then he lifted it and started scratching.
Okay, that's a good one.
Yeah, but that tells you that the fact is, are you sure? How sure are you that if you wear gloves and you have a protector, you are not going to, you're not going to put your fingers and inoculate yourself? But for me, the danger there is that because you're wearing gloves, you may not wash your hands. You may not use sanitizer because you think the gloves are protecting you. And then the danger is also you're going to pick things and then give to others because you are wearing gloves, so you feel safe. So I'm giving you money, right? And I've picked things from all over the place. If it was my bare hands, I would have washed it very well, used sanitizer. But now I'm passing it on to others. And I think to an extent it may be unfair to others because you won't wash your hands and you're using gloves. So anything you are picking around, you're giving to others. I think if we stick to I'm learning to do this, you know. Everybody touches the face. At church on Sunday, I was observing people. We are told them, don't touch your face.
Jeez. I think it's when you actually think about don't touch your face, like your face just invites the touching.
Well,
I mean, it's strange. Because I'm thinking, don't touch, and I'm itching somewhere, and I can't help it.
That's true. That's when you itch.
You know that?
I know. Yes. So I've learned to use my arm to rub my face. It's a process.
Doesn't the virus stay in your clothes?
Well, I mean, I'm not going. I mean, it doesn't hang in the air unless I've been close somewhere who somebody was cuffed into my clothes or picked it from somewhere on the table. So you can see I'm very cautious. I'm not leaning on your table today.
Okay, so back to the face, the nose cover. Does it help?
I think it protects people from, especially those who are in intense being cared for. So, if you
now
have
everybody's buying
or
it,
you have it, you wouldn't give it to someone else. Okay, yes, but the thing is, the virus is not hanging in the streets.
Okay.
Okay, so walking away in town, I mean, I don't know why you'd be carrying a nose protector around. Maybe people feel comfortable, but that's okay. But you see, the problem is, be careful that when you age, you don't go up there.
Yeah.
Because when you go up there, then you're actually defeating the purpose why you're wearing the nose.
Good advice. You want to chip in there?
Well, you see, for the gloves, technically speaking, it's not really helpful.
Okay.
In the sense that if you think that wearing a glove all day is protecting you, you may be lying to yourself. Truth is, it becomes another surface for the contacts to happen. So that glove you think you've used all day is actually contaminated. And like he said, you haven't had the opportunity to wash your hands and all that throughout the day. So you end up spreading the virus with the infected glove. With a mask, it's protective to an extent. It's designed in such a way that it can prevent what the wearer is bringing out. And at the same time, there's also a barrier that prevents somebody else from introducing it. So if somebody is infected, at least it helps in preventing large volumes of the virus being spread around through the droplets. It's concentrated within, and the person more or less has his own issues. At least it saves the rest of us to a large extent. The other side is somebody coughing on you. If you are not too lucky, the droplets could come towards this area and then you also get infected. But when the mask is there, at least it forms a barrier and reduces the amount of inoculum that can enter the orifices as we described. So the gloves the mask to a large extent can give you some protection. But like we keep saying, regular washing of hands with alcohol-based sanitizer, preferably 70% alcohol-based and more.
Okay.
That is the best form of sanitizer, not those below 70%.
Okay.
Because the studies show clearly that that concentration of alcohol is able to disfigure the viruses to an extent. So more or less, it makes them inactive or it kills them. Okay. By and large, that's the whole idea.
So that's an important point. If you're buying sanitizer tonight, check the labeling.
Yes,
and see if it is 70% and above.
Yes, and above. That's the best.
So if it's not on it, what do you do? Because 2 days ago I was looking for one, I didn't see it, I didn't buy it.
If it's a genuine product,
should be on
sometimes it will even tell you that it kills, in quotes, both bacteria and viruses. Okay. That is also okay.
Okay. Is there anything you want to add?
If it's been properly tested and passed, usually the ones that can disfigure the viruses and all that are the 70% and above. So if it's a proper, genuine product with all those labelings on, properly approved, then you can rely on that. But if you are not sure, make sure you get the percentage.
The percentage. Is there anything you want to add to that?
I just want to say check the expiry date as well.
Yes.
Okay.
Very important.
And then, unfortunately, I have to say this here. Well, I hear that people are now making. I mean, you can actually make your sanitizer. It's possible if you follow a protocol. Yeah. But be mindful where you buy your sanitizer from.
Okay. Why do you say that, though?
Well, I mean, I just heard over a bird spoke that some people were now selling sanitizers. Yes. And I don't know where some of them are from. So just be careful where you buy it from.
One quick thing, with the use of the sanitizer, and as much as we encourage people to use it in the absence of water and soap, I mean running water and soap to wash your hands, if you go beyond 6 times use of the sanitizer, then you also run a certain risk. First, it used to be about 10 times before water, but further studies clearly show that between 5, 6, 7 thereabout, you need to wash your hands.
Why?
Because it's like, how do I put it? It's about infection prevention and control. Okay. As we continue to use it, certain films are formed on the hands. It is not something that can clear everything like the way water and soap will do. So water running water soap is the right approach, the best approach. And in the absence of that, you go the sanitizer way. But that does not mean that you should replace washing of hands with it entirely. Basically, that's what it is.
That's a good point, because people are buying it for homes. I mean, I nearly fell into that trap. I bought the thing, I got home and I put it in the kitchen. And so I'm like, there's water. So I took it. I'm like, if you're going out, then you take it along. But people are buying. That's probably is why it's finished. If you're home, you don't need it because there's water.
I mean, once you have running water and soap, try develop that culture that you continuously or you regularly will wash your hands with running water and soap properly. And when you are washing your hands, please don't forget the fingers as well. The way I see people use the sanitizer and all, they just point into their palm.
And then do this.
No. The viruses can hide, you know, you make a fist like this. I mean, you put the 5 fingers together and the nail beds and all that. All these areas are places that the viruses can actually be found. So when you are doing the hand cleaning, it's a comprehensive thing. In between the digits, behind the hand itself, the palms, and then these areas as well. You
so
need to,
your nails.
Yeah, the nail area. So you put the sanitizer in your palm like this, and you rub against it to make sure that whatever is hiding within the nails, it's sorted out. Same with this end as well.
Interesting.
Yes.
Oh goodness, then we've all been doing it wrong. Oh my goodness, I just spot in the thing, do this, and
so you can say it's next to washing your hands by using alcoholic rub.
I mean, but from what he's saying, we're using the sanitizer, but we're doing it wrongly.
Yeah.
Because some they just pour very little, like a drop. Especially the ones that the electronic dispensers. When you do this, and then it's there, tiny little drop. And we do this, we have to think,
fine, need to get another bit more, and then make sure you because it has to cover every bit of the hand.
That's interesting.
You see, you don't rub and leave areas untouched. See, if you just do this, you are leaving a lot of the areas untouched. So if the virus says it's at the back of the palm, and you haven't really rubbed those areas, you can still contaminate yourself with it.
With it. I mean, good education there. Never knew, and I hope you're learning a bit about this as we all begin to learn more. But the point you made about contact is also important to me, because there are many who think merely because you were in a vicinity where somebody who is positive was, then you have it.
No.
I mean, but you saying that's not what it is.
No, that's not what it is.
Okay.
You see, okay, so let me start from the president's directive.
Yeah.
You know, they are limiting to 25, numbers of 25. I don't know the rationale behind the 25, but I hear other countries, for example, in Israel, it's 10.
Yeah.
But be it as it may, it's 25. The thing is that you have small numbers you can manage. And if you are seated apart, you're reducing the amount of contact, what do you call it, social distance. You want to give. So you are reducing the risk of, even if someone there even has it or has the virus and is not showing symptoms and probably is shedding the virus. The fact is, because you are fewer, it is easier for you to follow up even on the people who are in the meeting. So coming to that point, it's important that all meetings that can be avoided should be avoided. That's my opinion, because we're saying that we don't, and 4 weeks is critical for us, because now that we have imported cases who have also had contacts, if within the 4 weeks we don't have any new cases, that's a good thing for us. But if we start having new cases, God forbid, but if we start having new cases, then we are having
but not the imported.
Not the imported kind.
It means
but
the horizontal.
As in possibly those who imported it then might have passed it on to someone.
So it's not automatic that because you have been in an environment, you will definitely catch it and be infected and show disease. And the next thing is that I think we should also remind ourselves that it's important that now for any meetings that we go for, now that we are encouraging small numbers, we always keep records of names of people who come for the meeting and their phone numbers. And keep them.
Why is that important?
Well, I mean, you never know. If anyone turns out to have symptoms later, then you want to inform those who are at the meeting that, unfortunately, this person who are at the meeting now has symptoms of COVID-19, and we're at the meeting on this day together in this room. And so it's important that you self-isolate, observe, and then call for help if you need help, if you think you are developing symptoms, because that is the surest way we can monitor and do effective contact tracing to help. It's our social responsibility to do that, to make sure that we can help.
Okay. I mean, what you just said is very important for the contact tracing, because once you pick up a confirmed case, the protocol is we do our best to trace each and every direct contact that the confirmed individual, the confirmed case, has associated with, because there's always a risk of the contact. The contact is not only about just physical contact. We should also bear that in mind. Like he said, the surfaces around us could be contaminated. Yeah. And the more we crowd to occupy a small space, the higher the chances that we'll pick up things from the contaminated environment.
Okay. So that is why everybody who were within a radius of this person, just check, just to make sure that avoidance of doubt is cleared. Yeah. We're trying to have a conversation about avoiding the worst case scenario. The thing about what has happened to us is that other countries have had it for a while, and we can learn from the lessons. Let's go to some of the specifics that GMA has touched on in your statement. You talked about PPEs, for example. Today we heard from the Ghana Health Service saying that they are expecting more in. The nurses have issued a statement saying they don't even have the basic ones like the nose cover and the gloves. Do you have enough now?
Well, truth be told, at this point, because we also have cases that we are managing, we have started more or less running down the numbers that we have as a country. The PPEs? Yes.
Can it be reused though? That's a question.
No, you cannot reuse. You cannot reuse.
Oh, you can't?
No.
So all that protective clothing that you wear from head to toe, once you use it once, you remove it and that's it?
Yes, basically that's it.
Oh,
let me take you through a simple process, how it works. Before, take that you are in the treatment room where you are going to manage a patient. It is designed in a certain way. So there's an area where you dress up. There's an area where you prepare whatever you're going to do. And when you go right into the room where the patient is, you need to spend as little time as possible with the patient.
Why?
Because the more time you spend, the higher the chances that you also get contaminated.
Even with your PPE?
Yes. And the PPEs themselves, by the time we finish, you understand why. The PPE themselves are also very hot and a bit uncomfortable as well. Okay. But that is not even the major thing. But the whole idea is you try to reduce the contact time as much as possible in order not to get infected. Now, before you go in, you have to plan exactly what you are going to do for the patient, exactly where, how, and what you are going to do. So you go in and you go and do the specifics, and quickly you are out. Now when you go out, we take you through a specific pathway. You go into an area where you are going to get decontaminated.
What's that?
The decontamination is that we assume or we presume that you've gone in, you may have been contaminated. You don't have to come out and contaminate others. So in your full PPE, your boots, everything, we have what we use to decontaminate. Most of it contains chlorine and all that. So it was actually going to be sprayed on you completely. There's also a way of taking off your gloves and your PPE and all that. And the moment all of it is out, including your boots, which will be soaked in chlorine, everything is damped, and that is it. You don't go back to wear it.
Wow.
Yes. And then we've catered it such that you take certain steps to decontaminate even the boots that you are wearing before it is off your legs completely. So you enter from one end and you exit from one end. You don't go back the same way you came in.
Goodness me.
Yes. And in a day, depending on the severity of the case, you may have to go and see this patient maybe 6-10 times. It all depends on the severity. So if the patient needs a lot more attention, then anytime you go, it means the PPE is being used. It's a one-off thing. Mind you, it is not only the doctor. You have nursing staff, you have probably people who will come and take samples for lab. Because when you are in there, we do all kinds of things. So it's just like managing a non-COVID patient who is on admission. You take your samples and all the things that you do. So if, let's say, you have a team of, say, a doctor, say 2 or 3 nurses, or 2 doctors, 2 or 3 nurses, plus some lab person, and then, let's say, oddlies who may come in once in a while to do some cleaning and what have you, you could have a situation where at each particular go, you could have between 2 to about 6, 7, 8 of the PPEs being used just on one patient. So if you go in 6 times and you say you use 6 at a go for all the entirety of the people you have, so 6 times is like 36. It's gone. So managing a case is completely different from the protocols that were being run whilst we were preparing. Okay. So we are at a point where consumption has actually gone up. Okay. And then because we also have cases within the country, what it means is that you take a presumptive position that there's been contact with the community. So potentially there could be other cases out there. And that is why we are doing the contact tracing and what have you. So once you take that presumptive position, then it means that the cases can also end up anywhere within the country. Yeah. And what that means is that the frontline health staff or the health professionals within that region, that district, should be ready to be able to handle any case that could appear anywhere. Mind you, the infection could have happened here in Accra, but the person could travel to his village or another town to do business and then he falls sick. So it is not that simple. So we are in the phase where we need the critical logistics.
Okay, and obviously we don't have enough.
We don't have enough.
I mean, the truth though is, all over the world, nobody has enough.
Nobody has enough.
Even the US has found it difficult.
Even China struggled at some point because they were the people who were hardest hit, but in terms of medical consumables, they produce virtually the largest as far as the world is concerned. But they were still struggling. So in our case, the unfortunate thing is that we are at a point where a large majority of the world now has the disease in their environment. So everybody needs the same resources. And we don't manufacture them, unfortunately.
Goodness.
So we'll have to find ways of importing them. But thankfully, the WHO, the Africa CDC and all that are also helping to get some of these things for us. And sometimes at the WHO, once they know you have a case, even though the resources are limited, they do their best to also make some available to you because you really need them as compared to somebody who is yet to get a case. So it's a very dicey situation.
It is.
And we'll have to manage. But in terms of the resources, we need to do our best to make sure that we have them at the facility level because the healthcare personnel, the frontline people, if they don't feel protected, then all the stories that you've heard around will be happening because you hear, oh, they were not there. And because nobody will want to walk into danger. Even our laws as a country does not permit that. The labor law is so clear that as a worker, if you find that you are in danger by way of your working environment, you have to walk away.
What are your members telling you across the country?
Well, I mean, some of the things we put here basically are from our members.
Okay, so this is a collection of that.
Yes, of course. We have also done our own in the technical analysis of what is happening. We've been to the treatment centers and what have you to see the state of preparedness on the technical ground, not in quotes, the fanfare and all the bits that we do. No, we go there to look at specifics.
I'm curious, is the planning and preparation we heard about, is it translating into reality on the ground?
To a large extent, yes. But you see, when the reality is with us now, then the minute details begin to pop up.
Okay.
Look, as far as I'm concerned, or we are concerned, as a country, at the national level, the superstructure, the framework, everything is perfect, generally speaking, in terms of the structure. But when it gets to the practical bit of it, and then trying to cascade it down to the last facility in the country, that is where you begin to see some of the problems emerging.
Okay, I see. Prof, let me bring you in here. So clearly, from the GMA's point of view, it's also all leading towards preventing further spread, but also making sure this doesn't get out of hand.
Yes.
So in keeping with that, the president yesterday did something unusual, announced all these emergency measures that he's put in. Listening to him from a professional virological point of view, what's your verdict on the measures that he's introduced?
Well, I think that the measures are good. There are people who are of the school of opinion that we should ban travel completely. I don't know how that is going to work, but generally it means that we have to associate in smaller groups if need be. And I want to stress that.
Why do you add that?
Yeah, because you see, we are saying that people have come into contact with the virus. We don't know where they have been, and we're trying to trace the contacts. So assuming that I have come into contact with that person, I'm likely, and I get it infected, I'm likely to pass it on to somebody at another point. So you're being in small groups, you're preventing group meetings, actually will prevent the spread of the virus. And staying at home more frequently, going out only when it's necessary. I think we've reached that stage. Because, and I said before that, if we can do that, even if people come up with symptoms, infection, and then because we have reduced associations, large associations, and even 25, but even small associations, what is happening is that if there are local cases, they will still remain as local, because people are now trying to stay on themselves, by themselves, or limiting their contact with others. So it's extremely important that these harsh measures be taken to reduce our interaction with each other, that is one, and also to prevent, assuming that even we identify a person who's infected, to prevent that from getting out of hand.
Let me ask you, I want to probe this a bit more. So the president announced a ban on all gatherings.
Yes.
But he on the clubs. No, it's important because the churches, you were Reverend Minister, so the churches were banned, etc. But for the clubs, they put in a different category. They can run, they can operate, but use the measures that we've all talked about at the beginning. What's your take on that? Not speaking as a Reverend Minister, but speaking as a professional virologist.
I am not in the
and knowing how the thing spreads.
I'm not in the president's mind or whoever his advisors are, but I saw that bar issue in the context of 25 people. Okay, they were saying that we shouldn't associate in big groups, but maximum should be 25 people.
In fact, if you listen to him closely, the 25 was in reference to funerals.
Yes, private burials.
Yes.
Private burials.
Yes. That's
so for the clubs, there was no number there.
Yes.
So far as you practice he mentioned that, so far as you practice the hygiene, you provide the sanitizers and the hand washing, the club, if the club can take 50.
Well, so I'll tell you what I put on my classmates. Okay. My classmates, we're having this discussion on our platform. My point was that it probably could have been avoided completely by saying that all clubs, no club meetings. Because if you're in a small room without ventilation, so I'm doubting. That's how the clubs are. I'm doubting.
One door in, one door out.
So my doubt is because I have an idea of some of the people who advise him professionally, and I doubt that they would think that. I'm not thinking for them, but I doubt that they would think that within that club context, you wouldn't have people transmitting it. So I saw that. That's what I'm saying. That we could have avoided it by saying, okay, let's just cut off all these things. Yes. And then we rather say that we should, but I think that we know what we are supposed to do. So even if there's been a mistake or some sort of miscommunication on an issue, we shouldn't hammer on that. The fact is, it can be transmitted.
No, the reason why I think we should isolate it and talk about is because if without the right communication, you lead to potential spread. So this Friday, people hear the club one and they say, "Oh, for club we can go."
No,
but that's the risk of just allowing what the president said to go without probing it for people to know that the risk is there. Once they hear the president speak, if they're not educated like we are doing now, they'll say if the president has said it and they put clubs in that category, and they say once they can wash your hands and I go in and that is there, then it's okay. I can go in and have fun without taking precautions. That is what I want us to deal with.
So the club is an enclosed place. Right. You need good ventilation. if somebody's coughing, etc., to be able to get that. And there are tables that people may cough on and things like that. It is certainly not a safe place. A safe place where if somebody is infected, you cannot get infected. So that people should take it out of their minds that the club is a safe place. Okay.
Even if you go and there's water, there's soap, there is
then the churches could have
done the same. Okay.
So we can decide to meet and wash our hands, etc., and things like, because the club, the numbers are likely to be more within the
and
club.
There are more tighter spaces in the club, actually.
Well, more than the 25 that the number is talking about. So be it as it may, let's put it this way: nothing makes the club safe. Anywhere where you don't have good ventilation is a no-go area. If I have started driving with my windows open, if there are people in the car, but if I'm alone, that's okay for me. But when I'm with people, I decided let's have the fresh air. It's better. So even a bus went for a funeral recently in the church. I said, okay, let's open we don't use the air conditioner, let's just open the windows. So it's important that we should know that if somebody coughs into the air, you can inhale it, even though likelihood is that it will ultimately settle on the surface. So, but if the distance is short enough, you can actually inhale whatever the virus from the person. So the club certainly is not a well-ventilated place, that's one. They have surfaces, and you wouldn't even see people coughing because of what is going on. So it is certainly not a safe place, and that's not.
So pay attention. This conversation is so important. He hasn't said it, but for me, listening to him, my takeaway from what he said is avoid the club at all costs this Friday or whatever it is. Doc, what's your take on this? Are you a clubber?
Evans, I think that, like Reverend said, we shouldn't take the clubbing out of context. The president made a statement, yes, but we know that the risk still exists. From where I sit, I don't speak for the presidency, and I also did not advise the president, so I cannot really tell exactly what informed the decision and the context properly. But I could also figure out something by way of the presentation.
Okay.
First, I think that it was more of economic activity not being stifled.
Okay.
Because if you look at it, he sort of tried to encourage us to continue with business.
Yeah.
Go to the offices, what have you, cautioned drivers, but didn't say, look, don't travel, that kind of thing on a bus. So I think that in this context, we also need to think about economy.
Yeah.
We cannot take measures that will completely shut down the entire economy. That will not be in our interest. Our economy is still fragile. Okay. We've made a lot of gains, but it's still fragile. And then he also put in a caveat that these things, as put out there, are going to be reviewed, and when the need arises, further actions will be taken. He also asked that the Minister of Health, the powers given him by the Public Health Act, also come up with an executive instrument. Some bits the AG is going to take them to the House of Parliament for the necessary legislation and all that to happen. So I think that out of those caveats, whatever the fallout is, whatever the second advice that he may be getting, all these things can be dealt with. Okay. So we shouldn't look at it as if, because he mentioned that, then it gives us the freedom
to just go and just do anything else.
Clearly, the measures are intended to protect all of us.
Absolutely.
And to limit spread. And I think that should be the focus.
Okay. I want to go to a point that you touched on about shutdown. And Prof, I want to bring you in here. The lesson I've learned watching it unfold from China, etc., that almost all the countries get to a point of total shutdown. China eventually, very quickly got there. No movement whatsoever. In Spain, it's happened. In Italy, it's happened. In the United States, many states, total shut, no movement whatsoever. I wonder, should we, the measures yesterday were tough, but did it go far enough? If the lesson is that countries get there eventually, we have 6, should we wait for how many before we get there? What's your take on that?
You mean a total shutdown?
Total shutdown,
Well,
where you stay in for 2 weeks.
Yeah. I don't think we've reached a stage where we have a shutdown.
But that's my question to you.
Yeah,
if
so,
we are not reached a stage, what would you see before you say we are there?
So when
and wouldn't it be too late?
I would be concerned, or we will gradually drift to a shutdown when people who are not traveling are coming down with the infection and disease. That is when I'll be concerned. And if the numbers are increasing, you can't shut down.
But why must we get there before we do that?
Well, you can't. So these measures I see are tough enough, at least for now.
Okay.
So let me put it this way. If Noguchi confirms or KCCR confirms one case that was acquired here, not imported, and that person is a person who's not necessarily staying with that person, then I'll start getting concerned that, well, we are getting to that place. It means that many more people may have that. But the epidemiologists have their own way of measuring when to shut down. But I think that these measures are tough, and if we can stick to them.
But are they enough?
And if Ghanaians are sincere, we can make progress. I've just been told of a case where a person traveled and came from Germany, and this is 1 week. The person's wife goes to the clinic and does not divulge
the travel history.
Because they want to ask you questions. So the front line again is a problem, but this makes it serious because if Ghanaians are sincere, we will make progress. A classmate of mine came. He said, well, okay, now he decided he will self-quarantine himself. He went to the US for the period. Just stay away.
Going for 40.
Yeah, but we have to be sincere because you see, government can do everything if we are not sincere. And if we can't keep saying that, well, I can today, or I can go out, I don't mind, I'm not sick. We have to be sincere.
And make that point for me about getting sick, because for the 14 days, what happens? You can actually walk around with this.
No, you're not supposed to. You're supposed to isolate yourself.
Okay, but the thing you made, the reason I want to go there is, people say, oh, Ghana. I mean, so, but you're saying that
2 to 10 days.
You won't show any symptom for a while.
Yeah.
For how long? For how long?
Well, 10 days, I think that what I saw from WHO, the records they've kept, I think up to about 10 days, you can start showing symptoms.
Usually from day 1 up to 10 days, you may not show anything. But beyond day 10, or from day 10 onwards, you
start showing.
Yes. The symptoms could happen on the 13th day.
Or before.
Or the 14th. And sometimes the symptoms could start, but with all due respect, the untrained mind might not even know that this is one of the symptoms until it becomes so obvious. So sometimes people come, you talk to them, and they will tell that, oh, the symptom is just maybe a day or 2. But when you probe further, you're able to see that, no, probably it's even more than a day or 2. Yeah. We as technical people have a way of asking some other questions. So they may tell, oh, okay, I remember that probably 4 or 5 days ago, I had a mild cough. Just a one-off, so, but that probably was the first symptom for you as a person, so it's something that is important. What is so clear is that the 14-day window
is important.
It's the incubation period, and we all know that it is very important. The other thing we know about viruses is that it is not only when you are showing the symptoms that you can infect others. In fact, for viral infections, sometimes they are even more effective, for lack of a better description, before the symptoms actually pop up.
Interesting.
So, for example, let me give you say what we usually will call chickenpox.
Yeah.
Okay, it's a viral thing. Now, before you see the eruptions on your skin, that, let's say 1 week or 5 days before you see the eruptions, that period, it is actually more effective than post the eruptions on your skin.
Me.
Yes. So at the point that traditionally you see people with the calamine lotion and all that, oh, don't come close and all that, he may have actually infected you.
This is dangerous. I mean,
before.
So you'll be walking around with your friend who is fine, he's running with you, but he may be carrying it and actually passing it on.
Yeah.
But that's why contact tracing is done. They try to find out how many days ago you met that person.
Okay.
Because it's called the prodromal phase, before the actual symptoms come. So that's why contact tracing is important, because this person fell ill after having contact with others. And so you want to go back and make sure that, I think if I'm right, they go back 2 days. Yeah. They go back 2 days, those you saw within the past 2 days. And you want to make sure that they are all safe, because around that time the person may have been shedding the virus. Okay, and then you can have even asymptomatic infections, people who are symptomless and are walking around.
As in, they will never fall sick.
Yeah. So,
but will carry the virus.
So we need.
How is that possible?
Your host immune system is different for everyone. Everyone's system is different.
As in, they'll be, if you test them today, they will test positive. But they will never fall sick. They will have none of the symptoms. No, they won't cough. No sore throat.
No, they won't cough. No. If you don't have symptoms, you don't have symptoms.
Goodness.
But you can still actively shed the virus.
You see, even for those who will be confirmed cases, we have 3 or 4 categories. We have the mild, the moderate, the severe, and the critically ill. With the mild ones, within that spectrum, it might not show so much. Like you said, there are people who may be asymptomatic, generally speaking. Yes. So, in terms of the host's own immune response, sometimes you are able to deal with infections better than others. Of course, the inoculum, the amount that also got into you also determines
the viral, it's already called the viral load.
Yes.
Okay.
That also sometimes, look, if the viral load is that huge, then the chances that it will break you down are way higher.
I heard something on BBC today that's why health workers are at most risk of getting critically ill, even when they are young.
Yes.
Because of the viral load.
Yes. And then, I mean, at this point, because it's novel, so we are all, in quotes,
susceptible.
Yes. But sometimes, even within a community, you could have what we call resistant strains. And those ones tend to be more, in quote, harmful than the non-resistant strains, because those ones, you even treat them with basic stuff or basic medications and you've been gone, the non-resistant one. But with the resistant strains,
they don't respond to any treatment.
They may not respond to the baseline standardized treatments.
Okay.
And there's no drug anyway for this, so you're talking generally with viral infections.
Generally.
Let me ask you briefly on the thing about shutting down. What the question I asked him about, should we do it now or wait till later? I mean, his position that wait till later.
From what we
should
said,
we do it now?
as we stated in our communication, it's the first bit.
Yes. And now the government comment that when we all call on Ghanaians to support and comply. So you think this is enough?
For now, we think it's enough, because you see, there are 2 stages to the whole problem. The first stage is what we find ourselves with, i.e. imported cases. If we are able to isolate these ones, control and manage them properly, and also prevent our local population from getting infected, like Nigeria did.
Yeah, fantastic.
Once you are able to contain it, then you can manage it.
But Nigeria spotted it at the entry point.
Yeah, that's what I'm saying.
That also helped them. Our case, the people have been here for a week, close to 2 weeks before we spotted it.
Ivan, this is exactly what we are saying. So for now, in our case, because, like I said earlier, we have taken a presumptive position that the virus
is out there.
It's out there because there's been contact. But that does not mean that presumption is not reversible. Okay. So the contact tracing and all the things that we are doing will ensure that that position is ultimately rebutted or otherwise.
Yeah.
But if you don't look at it on that basis and you just take it as, oh, this is nothing, and then you have cases slipping through the contact tracing mechanism, and these cases potentially end up being confirmed cases at some point in time, then what you would have done is that you would have allowed these people to be in the community for that long, and the chances that they would have spread the disease in the community is high. Once it goes into the community and people begin to spread from one to the other, that is what will ultimately lead to the shutdown.
How much faith do you have in our contact tracing ability?
To be honest with you, I think so far we've done good, except that, we are a country where sometimes it's difficult to identify people properly.
Sometimes it's difficult to identify people, period.
But if you look at the numbers that the president gave out, clearly we've done well. 107 contacts for one person what it tells you is that at least
it's been aggressive.
It's been aggressive.
Yeah.
That's in the contact tracing has been aggressive.
Yeah.
Yes, because for one case, per what the president said, which I know is true because I'm part of the EOC, the 107 contacts that have been made are in respect of one person.
That's a lot.
So that tells you that we are doing a lot.
Okay, not all these people, what will happen to them? Quarantine or test? Or
Well, it depends. Even within the contact tracing, you have, let's say, first, second line in quotes.
Okay.
There are people who live daily or are in constant, touch with an index case, the particular patient. So maybe the spouse, the children, maybe the people who work in his office or in his home, depending on what it is. They are like first line. And then there are people who may have just had a very brief
casual,
that kind of thing. So whilst you are doing it, you keep an eye on everybody, but you focus on some, in quotes, wanting to test them if the resources are available on daily basis or whatever it is. There are some that you just keep them in that self-quarantine where they are monitored, and then they give updates whether the symptoms are evolving or otherwise. So the way you handle your contacts might be slightly different, and
depending on
sometimes it depends on the resources that you have.
Very final question as we wrap up, Prof. Is about testing, right? America is struggling with it now. They're trying to struggle to get the test. How much? What level of access should we do the testing? In other words, should we do mass testing now, or we should just do testing for those who show symptoms? Very briefly on that.
I think for now it's those who symptoms, those who meet the case definition.
Okay.
But I just wanted to say something, add something to what said. You see, the reason why you need to get the contacts early, if you don't get them early, and they've been exposed and they start getting disease, the viral load increases.
Okay.
With increased viral load, it's easy to spread it amongst other people.
Okay.
So
I think one of the things you said, and I want to repeat, is that when you have meetings,